probably anywhere between 50 to 70% of us have some form of oral disease.
What's happening in your mouth is linked to Alzheimer's and heart disease, and it starts with your toothpaste.
Dr. Mark Burhenne is a leading functional dentist on a mission to fix your mouth.
If you want to lose blood pressure, drop the mouthwash, start tongue scraping. I know a lot of cardiologists that have taken their patients off of high blood pressure medication. It's the bug getting into the brain and how the brain reacts to that bug that causes Alzheimer's. There are other things you can do. It's not just diet. Mouth breathing, dryness of the mouth, dehydration. Most dental products are causing a dysbiosis of the oral microbiome.
So you were talking about mouthwash. Why is mouthwash bad? Because I know a lot of people have heard that mouthwash will kill the bad bacteria, will kill the bacteria in your mouth. Why is it bad?
Well, it's not that it kills the bad bacteria, it's indiscriminate. It kills all the bacteria in the mouth. And take the gut microbiome for a while. We know better now. We don't want to kill all the bugs in the gut. That would be an antibiotic, for example. And we know that there are implications, and it takes the gut a long time to recover. If it does recover, we know that the gut can suffer severely, ulcerations, bleeding, ulcerative colitis with certain antibiotics. Same thing happens in the mouth. We have our own oral microbiome. It's a little different. It's in a different position along the digestive chain, and it too can suffer. And so nuking the oral microbiome leads to oral ulcerations, canker sores, bleeding. But the big thing is that there are these bugs in the oral microbiome, good and bad. It doesn't really matter. These bugs, when working synergistically, produce a gas called NO, nitric oxide. The mouthwash tends to kill those bugs, suppress them, and then you don't get the nitric oxide. Without nitric oxide, you can elevate your blood pressure. We have plenty of studies. They're already 15, 20 years old. We also now have new studies that are just a few years old that even tongue scraping can lower your blood pressure. So the reason mouthwash is bad is because it affects the oral microbiome. And by affecting the oral microbiome in a way, it affects the oral microbiome in a way that NO production is affected. And we really need that to keep our blood pressure low.
What is the mechanism from that?
So tongue scraping modulates and keeps the biofilm, which is where the oral microbiome resides, healthy. That's why we brush our teeth. We're not removing the biofilm, which is what we've been told we're supposed to do. We are disorganizing the biofilm and keeping it, you can use words like thin and not from thickening too much or not becoming dysbiotic or, too starchy and thick, and preventing the flow of calcium and products that are found in saliva to the tooth and things like that. So that engine of that biofilm needs to work well. It needs to be very healthy. Scraping it helps. I mean, it can get very thick. So if you want to lose blood pressure, and there are studies that support this, just drop the mouthwash, start tongue scraping, work with your cardiologist. I know a lot of cardiologists that have taken their patients off of high blood pressure medication just by doing those two things. Yeah. So it's not going to work for everyone, of course. There are many different root causes of blood pressure, but certainly that's something that needs to be addressed. And cardiologists that are aware of this, and I know some, I've worked with them. There are several. That's a great integration between dentistry and medicine, and that's knowledge and information that they know and the production of that NO gas, especially after age 40, because we lose our other sources of production as we age. Don't use mouthwash. I mean, you're really shortening your life. I mean, NO has cardiovascular benefits, brain, immune system, metabolism, sexual function, and the list goes on there. Exercise performance. You're an athlete, right? You know a lot about NO. I mean, NO is really I think that's what you're working and living in Florida now. I think that's what Ponce de Leon was looking for. He was looking for the fountain of youth. He was a Spanish explorer, I think, during the age of exploration. And he said there was a fountain, and he found it in Florida somewhere. I'm not sure where it is, but I think it was really a fountain of NO, which is what he found. That really is the elixir of youth and health and vigor. And we really need to learn more about it. And the good news is that dentistry is responsible for a big portion of that. It is produced by the oral microbiome. So let's stop nuking it. Let's stop disinfecting the mouth. Let's give it some respect and start looking for things that can help our patients produce more NO
Mm.
gas. Yeah.
And you talked about tongue scraping, so it's just in the morning, wake up, tongue scrape?
So that's a great question. What's the best protocol? We're actually working on that right now. Just yesterday and last week,
Mm-hmm.
we're working on a protocol that would help boost NO. Part of that, of course, is tongue scraping, obviously diet. So when is the best time to tongue scrape? I tongue scrape first thing in the morning,
Mm-hmm.
and I'll tell you why. Your tongue hasn't been moving. Saliva flow is very low at night. The parasympathetics, I mean, the saliva flow is shut down. Um, that's what deep sleep is about. It's conserving, and I do mouth tape so I don't lose any moisture in the
Mm-hmm.
mouth. But there's been very little activity in the mouth, and so if at any time the biofilm will be less than perfect on the tongue, it would be early in the morning. It could also be after a very starchy meal,
Mm-hmm.
and a marathon, having your mouth open,
Mm-hmm.
dehydration, again, marathon or a lot of
Mm-hmm.
physical activity, or having taken meds. There are certain health conditions that lead to dry mouth, of course. So I think for a normal person, I think that's the best thing you can do is I would tongue scrape first thing in the morning and then drink a full glass of mineral water and just sit there and take a deep breath, maybe stretch a little bit. Just that's a 4 or 5 minute protocol that everyone should do every morning. So, but you know what? I don't want to uh, give people complicated instructions. Tongue scrape whenever you want, before you go to bed, after lunch, after a meal. There is no bad time to
Mm-hmm.
really tongue scrape. And if you scrape once a day, at least initially, it may take 4, 5, 6 weeks. Then you can tongue scrape every other day or every third day, but it's a great practice. And don't worry about the timing of it. And if you forget, let's say you are a morning person and you
Mm-hmm.
tongue scrape in the morning, but you forget, just tongue scrape when you think of it that day.